Like just there we go. Dr.
Live.
Webb and I were posing until we were live, everyone. It is Misha Green, DC editor, back again. I hope you guys are not tired of my face today, but at least I get to be. Oh, I pointed the correct way this time. Next to Dr. Cameron Webb, who is doing tons of amazing, wonderful things. Right now, he is on the White House COVID-19 response team, but like that's in addition to a long list of things that he's always up to. I'm currently looking actually at his University of Virginia School of Medicine page, just like trying to keep up with his bio and all his amazing work. But we're going to talk today about the COVID-19 pandemic, how the Black community has been affected, which we know has been in a major way, and a little bit about how we can sort of work to, one, remain healthy or get healthy if we're battling some things right now, but also about the COVID-19 vaccine, which I know we here at the Afro have talked a whole lot about, and from our viewers, we know that there's a lot of mixed feelings. So we have a lot to talk about, but you guys know the deal. We have to share the stream first, and as I always say, sharing is caring. So let's go ahead and do that. And while we're like attempting to finesse and share that, Dr. Webb, do you want to tell us how you're doing? We are, I think, 363 days into the pandemic. Is that correct?
That's about right. So yeah, Thursday coming up. So just a couple of days. We're coming up on 1 year from when we had the lockdown, and of course President Biden's going to be talking about that some on Thursday. But it's hard to believe that it's been a full year nearly of all of this. And one of my great friends and colleagues, Dr. Tyson Bell, who's an infectious disease and critical care specialist here at the University of Virginia, he and I have done a weekly COVID-19 update since March 16th of 2020. And we initially, in the first one, we said, we'll do this for about 4 or 6 weeks and see how it goes. And 52 weeks later, there's still a need, because there's still a lot of information that we just have to get out to folks about this pandemic and the impact. So certainly it's been a tough year, but even through all that, right? Even through all that challenge, I always say we're still being blessed in different ways. We just have to find the opportunities to do our best to help people around us and to get through this collectively and together. But man, what a year.
What a year is correct. And thank you for all your hard work and dedication to getting out this information. I know it has been ever changing, including for you all in the medical field. I have to ask, because you are, big time in ranking and worked in a couple of administrations. Could you ever seen this coming, and particularly in the way that it's hit the United States and the Black community?
Sadly, I think, hindsight is 2020. If you look at so many of the dynamics we already had in place, you could say we should have been able to foresee that a pandemic was coming our way. In fact, that's the reason there was so much pandemic preparedness work that was ongoing. In the Obama administration, there was a whole pandemic response approach, and we always thought it was going to be an influenza pandemic, the flu. And so that's why we were spending so much time and energy there. And a couple of people saw that, hey, possibly it could be a different respiratory virus, something like, the virus that causes COVID is called SARS-CoV-2, but, something like a SARS virus. But we didn't know this was going to happen. The part about the disproportionate impact on communities of color, there's that old saying that when America gets a cold, Black people get the flu, right? The reality is that, because of a lot of the systemic and structural dynamics that are both historical and contemporary, it is going to hit harder in certain places, particularly places that are in some amount of economic and social disadvantage. And that's what we're seeing play out right here. And so I think that's where it's like, yes, we could have seen a pandemic coming. Yes, we could see something that affects all of America, disproportionately harming Black America. And so when you put those two together, we could have anticipated that something like this could happen. The key now is, how do we get through this in a way that's equitable and lay the foundation so that no future pandemic does this to the community the way that COVID has?
And I think that's a really good piece that you brought up and point that you mentioned about the fact that you all are working diligently to ensure that if something like this comes, that we're even further prepared. Hopefully, that it won't have the effect that COVID-19 has had on communities of color. So going back to uh, your long career or list rather of credentials, I should say. There, I don't think I've read this in a bio, especially for someone as young as you are. You are both a physician and a lawyer.
Okay.
Um,
Yeah, I've got all the student debt to prove it.
all the things that to prove it, which is quite awesome, but also the great credentials to prove it. And I just like want to see. I talk about just doing, all of school, college, and a master's, and like always, like constantly having pain in my right hand from writing so much. I don't even want to know the pain that you must deal with.
I'm a bit of a glutton for punishment, but for me, I always explain to people how that happened because, the joke people always make is, oh, you must have wanted to protect yourself from getting sued as a doctor. And that's not at all the case. It's actually that, I was passionate about healthcare since I was 5. My primary care doctor when I was 5 years old was a young Black man named Timothy Yarbrough, who still practices actually in Virginia. And for me, seeing him had a huge impact. We always say representation matters, and it does. And so that's what kind of sparked it. And I was like, hey, I want to help my community, serve my community in that way. And then fast forward and, really was focused on social injustice more broadly, and then looking at the social injustice in healthcare. And I was just like, this is a true tragedy. And what is the skill set that I can bring, that I can pull together to address both the health and social justice challenges? So that's where the idea of getting a degree in the law came in. And so, I was like, I ain't got nothing but time. So let me take 7 years, do the MD and the JD, and then really focus on trying to, bring some modicum of justice to the delivery of healthcare in the United States. And I felt like having those tools in my tool belt was going to be a key for that. So I'm glad that I was able to do it. I look back and I'm just like, ooh, that was a lot. But at the time, it was just head down, nose to the grindstone, and a lot of support, a lot of prayer. But, I think it's a skill set that hopefully can do some good for a lot of people at this point.
Well, I know that it can definitely do a lot of good for a large group of people. But it's great that you were aware and saw the intersection between health and social justice. I think that that's not a conversation we've been having regularly until the pandemic hit. When I was in grad school, which was in 2015, we were like feeling very cutting edge that we were tracking the health disparity in West Baltimore, and finding the major racial inequities in that. But it's been a very long time coming to have these kinds of conversations. And you saw it over a decade ago. First of all, why do you feel it's important to be a speaker and advocate for the challenges that's seen in the health community when it comes to racial inequities? And also, tell us exactly what you do.
I can definitely do that. How about I'll start with the second part of the question, was what do I do? So currently I serve as the senior policy advisor for equity on the White House COVID response team, and so I work with the small team that's tasked with really pulling our nation out of this crisis. We're working on the vaccine front, yes, but also on testing, also on the therapeutics that are out there, the range of dynamics that come together to really improve the nation's opportunity to get through this crisis. So that's one thing that I do. That's what I do in the White House. I'm a practicing internal medicine doctor, so I still do see patients. I work on the coronavirus unit, or the special pathogens unit, at the University of Virginia. So when I came into the White House, when I was asked to come in and serve in this capacity, the one request I made was, can I continue to see patients, because we're in the middle of a crisis and I want to do my part, and so I still do that as well. well. And then I think, and that's a big part of who I am. The lawyer in me, I was so part of my role at the University of Virginia was I was the director of health policy and equity at the University of Virginia School of Medicine. So I'm currently on a leave of absence from that role to do my White House job. So a couple of different jobs in there. My most important jobs, of course, are husband and father. So my wife is an emergency doctor. She's been on the front lines for a year, working in the emergency department, saving lives in the midst of this pandemic. And then I've got a 9-year-old and a 5-year-old who my 9-year-old has not been in school physically. She's been virtually for a year. And so she's excited. She actually goes back this week. So that's kind of what I do. I'm excited too. She's excited. But you asked a great question. Why do I feel like it's so important to be an advocate and to speak up in these moments? And I just look. You've heard the phrase, the arc of the moral universe, like the arc of our history. If you look at it, go back to the arrival of enslaved Africans 400 and almost going on 402 years ago now, right? So that arrival, and then you look at what was called the slave health deficit, and then you look at W.E.B. Du Bois and the Philadelphia Negro when he described the disproportionate impact in communities in Philadelphia, and then you look at Dr. King, who in the mid 1960s said of all the forms of injustice, the inequality in healthcare is the most shocking and inhuman. You go 20 years later, and Health and Human Services released a report on Black and minority health that outlined all these disparities. And 18 years later, in the early 2000s, we had the report Unequal Treatment. We've been talking about disparities and inequities for a really long time. And I think that when it comes down to it, every generation has a responsibility to move that ball a little bit farther and to move us closer to equity. And I think we're at a point now where we've got everything we need. We know the size of the problem that's in front of us. And that's why I think I'm so excited to work in the Biden-Harris administration on this, because I've worked in a lot of places, a lot of different institutions, and a lot of places you'll say they're not ready to talk about equity. There are some that are ready to talk about equity but don't know how to get it done. With President Biden and with Vice President Harris, they understand the issues and they're ready to get it done. I mean, the commitment is very real. And I say that as genuinely as I can, because I can speak for myself. I wouldn't be in this space if people weren't about this work, right? And I think that's what's exciting, is to be in a space working on equity, knowing that I don't need to sell it up the ladder. They're saying, well, how are we doing on equity? Where's our focus on equity? I mean, the vice president, back when she was Senator Harris, was championing this in the halls of Congress. So this is the priority. And I think that's a good place to be in. So that's why it's so important to use these moments. We have leadership who's about the work. These are the moments to dig in and to really get something done, to make some meaningful progress, because lives are on the line. So that's why I'm excited about the work I'm doing right now.
Well, we're excited that it is a priority in the current administration and that you are there doing the work. And you talked a little bit earlier about your childhood, your pediatrician, Dr. Yarborough, right? And the fact that representation mattered. And I'm wondering if you feel a certain different sense. I mean, you've worked in a couple different administrations. You worked for the first Black president, right? And with My Brother's Keeper, which was super cutting edge and definitely got the point that representation matters. But I am curious if you have a certain sense of heightened responsibility being a man of color, working as a leader in diversity and equity in the world of healthcare. And if you could add, just if you all are doing any work to bring more people who look like you guys, or not just like you, but people of color into the space to create change and ensure that there's equity in the healthcare system.
Well, the funny thing is, when you ask the question, do I feel a certain responsibility as a Black man, my mind immediately goes to you referring to the reality that Black women have been holding this down for a really long time and are the ones that have been leading the health equity movement, particularly for communities of color, for a long time. And so do I want to do my part as a Black man to help Black women out? Yes, I do. But I think more broadly, I think this is just one of those moments where everybody has to bring what they have to the situation to try to make a change. I mean, the statistics that we're able to see, the data that we have that shows us the disproportionate impact of so many conditions on communities of color tells us that the time is it was at least a few years ago, if not, and if we can't do it then, if we couldn't have solved this in years past, then the second best time is right now. And so that's why I say it's so important to do this work. But I think that, there's something in academia that we talk about, and this takes a lot of different forms. But being a person of color who's really adamant about this work, we call it the minority tax or the black tax. You are always pulled into this work in your institution, in addition to all your other roles that you have. And so you kind of can't turn a blind eye to it, even if you wanted to. And if you're passionate about it, you're just going to be pulled even more so. And I think that this is one of those times when we say, yes, you get pulled into this work, but we want to do this work. All of my colleagues, particularly here at the University of Virginia, where I work, everybody has been saying, how can I do my part? And I've seen some really dynamic work. Actually, my wife and a colleague, my wife, Dr. Leanne Webb, and her colleague, Dr. Ebony Hilton, they wrote a children's book together about COVID-19 to get the word out to children and communities of color, that everybody is doing whatever they can do to make sure they're making a difference. And so, I mean, yes, we feel a responsibility. I think it's no different than the responsibility that a lot of folks in our community are feeling right now to say, how can I help lighten the load? And that's where we are. And I think that when you're in a position, you mentioned working across administrations, I think all of these experiences build on each other because, my first time in the White House, I was a White House Fellow, which is a nonpartisan program. And so I came in at the tail end of the Obama administration. I worked on the My Brother's Keeper initiative and on the White House healthcare team. So I'm working at that intersection of social justice and health. And then the time spanned into the first few months of the Trump administration, which was, suffice it to say, a very different environment for me. And I think that what I learned from that space is that in any space that you're inhabiting, you have to do the work. And sometimes it's fertile ground, like with My Brother's Keeper. Sometimes it's less fertile ground, but the work remains. And I think it makes you appreciate times like this administration all the more, having been a part of the last administration in its earliest days and saying, now we're coming into an administration that's starting off saying, how can we work on equity? Those are words that are music to my ears. And so, yes, have a responsibility to do that work and to do it well for everybody to push, but also encouraging everybody to hold us accountable, because that accountability from the broader public is part of what creates that dynamic where folks say we have to solve this equity crisis. So keep it coming. Keep your eye on what's happening locally. Raise it up and say this isn't okay, because that's what creates the force and the energy and the political will for us to keep pressing even from within.
Thank you for that answer. And also thank you for shouting out Black women in general who've been making it happen forever. But also kudos to your wife, Dr. Leanne Webb, who is making it happen and also ensuring that she is on the front lines in emergency medicine. And of course, you too, to still be practicing with, I'm sure your very busy schedule with all that you have to do with the White House. Just super kudos to you all, and thank you for the work, and thanks to Dr. Webb and Dr. Hilton for teaming up on that cool children's book. They have to come back and talk to us about that when they can. But I have to ask, because having been on the front lines, living with someone who's in emergency medicine daily, is there any sort of correlation that you've seen when it comes to the Black community in COVID-19, either how they're getting it, why the Black community sort of is struggling so much with it? I mean, we've heard because of pre-existing health conditions and things like that, but is there some through line that we should know as Black people that might keep us safe if we're tuning in today, that you just may have seen from practicing? I don't know if there's been an official research on this yet.
Well, there are a lot of different factors that come together, right? And if you look at it, one of the first things we noticed back last March, when, almost a year ago now, when we said, oh, we've got to shut down, work from home if you can, Well, the people who could, that's a privilege. There's privilege for who can work from home. The people who couldn't work from home, those frontline or essential workers in other capacities, disproportionately individuals of color. And if you look at the spaces that they were continuing to go to work in, that put them at an increased exposure to relative to that person who could, hop on Zoom and work from home, who is so frustrated at being in their basement all day. That's a very different thing than being a bus driver or grocery store clerk or any of those things that are critical to our society, and disproportionately folks who look like they were, folks from the communities of color. And then you add on top of that. So there's the working dynamic. Then there's the housing dynamic. And you think about, who has the ability to separate from members of their family and go into different floors if one person was to get sick, versus the way that it would spread in multi-generational households or something of that sort. So you had dynamics there. You had, the reality of chronic disease, which you mentioned. And so, yes, for folks who were to get sick, they could get sicker. But the other thing we noticed was that there was disproportionate access to testing. And so if folks were being tested at different rates, then what was happening is in communities of color, they were showing up to the emergency department pretty sick, and they were getting tested at the point of needing to be hospitalized, as opposed to getting tested early on and then contact tracing the whole family and really nipping it in the bud from a public health standpoint. So there are those dynamics at play. That's just a part of it. There are so many different factors that all came together to create this dynamic. But also remember, we still have large swaths of communities that are relatively, segregated. There's a lot of, racial isolation in some communities. And I think that this is a communicable disease, it spreads through contact. And so you see it impacting different communities differently. All those things kind of came together to start this pandemic the way that it was. One thing I remind people of is that it's not the kind of virus or the kind of infectious disease where you can turn a blind eye and you can say that's that community's problem. Because the truth of the matter is it affects everybody. We as a society, we are interacting with each other. The more viral spread there is in a community, the harder it is for any community to be open and thriving economically or socially. And so those things all are what creates this unique moment. Because a lot of times, and I'll use the HIV/AIDS pandemic as an example, it's disproportionately affecting a certain community, but there are people who say, well, that's not going to affect me. They assign some kind of value judgment to what's happening. But if you take a circumstance like COVID, that it can very easily go from one community to affecting an entire community, well, it's everybody's problem. And that's what creates this unique equity moment, is that people say, well, we have to solve the racial and ethnic disparities, because if we don't, we're going to continue to have high levels of spread. We're going to continue to strain our healthcare systems. Our economy will continue to be strained, and it's going to affect other communities as well because of the interactions between communities. And so that's what creates this unique moment. And I think we take it, we do our best to address the equity concerns, and then we say, how do we apply these learnings to all these other inequities that exist within health and just the lived experiences of communities of color? I think that's the important moment that we have.
And it's such an important moment. And I thank you for taking us back to how the confluence of challenges and just realities for communities of color kind of led us to where we are. I mean, I remember sort of beginning to have these conversations and asking these questions in late March, early April. And so just taking us back there, I think is really important. In terms of the COVID-19 vaccine, now there are 3 different companies that have released a vaccine that seem effective. But there's so much hesitation in the Black community about taking it, and yet we're the ones suffering so heavily. And I don't blame the hesitancy. There's a lot of misinformation though, and so that's why we're really excited to have you here today. First of all, tell us a little bit about the work that you are doing with the White House to educate people about the vaccine, raise the level of trust, particularly in the Black community, but also why should we trust the vaccine? And have you gotten it? I'm going to add that last little question at the end.
So I'll start with I absolutely got the vaccine as soon as I could. Very first day that I could. My wife and I actually got our vaccines together, and that was an exciting moment of relief for us because yes, in the hospital we take care of COVID patients. We're wearing our masks and gloves and gowns and face covering, eye covering, all of that. But we now have some immunologic protection. Now our immune system can also protect us from this virus, and that was a layer that was just so important for us to have. So we both got our COVID vaccines and
Can you
did.
share which? Can you
What'd you say?
can you share which of the different?
Yeah. So we both got the Pfizer vaccine. That was what was available. And what I tell people is I walked in the door at our health system, and they could have said Pfizer or Moderna at the time, but they were both available and didn't make a difference to me, right? They both work well, and you can add Johnson and Johnson to that list. We have 3 vaccines that work really well, that prevent death, that prevent severe illness. They are 3 really great vaccines. The biggest difference is the Johnson & Johnson vaccine is a single shot as opposed to 2. But that's what's exciting. We have vaccines that save lives, vaccines that prevent hospitalizations, and they all work really well. And it's great to have that. I think there are a lot of different things that go into what we're seeing. And so you asked about my work in the White House, and so I work closely with Dr. Marcela Nunez Smith. She has a couple of roles. She's a senior advisor on the COVID response team within the White House. And then separately, she's the chair of the Biden-Harris Health Equity Task Force for COVID-19, which is based at Health and Human Services. And it's a group of individuals really from across the country who are coming together to lend their expertise to solving this crisis. So she's wearing lots of hats. She's also still a practicing doctor at Yale. So you think I do a lot. Dr. Nunez Smith does a ton as well.
You guys are just masochists, I'm convinced.
Gluttony for punishment, like I said. But our work really is focused in a couple of areas. So yes, we want to focus on addressing, as it's called, vaccine hesitancy, but that has lots of different flavors. It comes in the form of complacency, folks who are just like, oh, I'm good. Like my barber, who I just saw a minute ago, who was like, I'm good. I don't really need a vaccine, but if I feel like I need it at some point, then I'd get one, right? That's one dynamic. Then there's the confidence piece. Folks who say, I don't know that it's safe, or I don't know that it's effective, or I don't know that I trust the hospital or clinic or pharmacy that's going to give it to me. Or finally, I don't know if I trust the government who's telling me to get vaccinated. That's the vaccine confidence piece. And there's a lot of work we can do to improve confidence, that we must do to improve confidence, because I think people need to hear from us that it's safe, that it's effective, and that the only intention here is to save lives and get us through this pandemic. And then the third version is convenience. And that's the vaccine access part. And we spend a lot of our time increasing access to vaccines. That's more venues for vaccination, like our mass vaccination sites, or like our retail pharmacy program that's getting more vaccines into communities through pharmacies, or even our federally qualified health centers, or the community health centers program that's getting vaccine to communities through those community health centers. We have to create more and more opportunities for folks to get vaccinated and just have spaces where they can go to get their shot, right? So those are kind of the big pieces of our work, is both to increase the access and to increase the demand, so to speak, for COVID vaccines. And I think that along the way, so much of what we spend our days doing are talking to communities, all the disproportionately affected communities, which yes, certainly include communities of color, certainly include racial and ethnic minorities, but also there's a lot of disparity based on rural geography, and my wife's from a pretty small rural town in Virginia. I'm from a rural county as well. And so I think that's where we say, hey, it's really important that we focus on rural needs as well. I think you add on top of that, folks who are individuals with disabilities, huge disparities there as well. You can also talk about bisexual orientation or gender identity, right? There are some unique challenges. And so we have to make sure that anybody and everyone who's being disproportionately affected by this pandemic, we're finding ways to connect them, not just with the resources they need, but also with life-saving or hospitalization avoiding vaccines. Those are keys. That's what we spend all day doing. And I think that's big work, but it's the necessary work of the time.
Absolutely. And we just thank you so much for the hard and big and necessary work, because it is one of those things, I think, at this point where we can continue to think that we're educating people, but until we hear it from someone like Dr. Webb, who's put in that time, right, and to not only heal people, but to also really fight for justice and equity within the healthcare system, I think is really important.
And just to add really quickly, I mentioned that I was just at the barbershop getting a haircut. And I think what's interesting about it is the barbershop, as a Black man, the barbershop's one of my favorite places anyway. It's one of those things socially you experience as you grow up. But every time I walk in the shop for the last couple of months, the barbers are just like, I'm glad you're here. We've got new COVID questions, new vaccine questions. And the four barbers at their respective chairs are just like, I heard this, I heard that. Somebody came in and said this. And you realize the places where information is truly exchanged, right? It's not about, having some big megaphone on television and saying, here's how it works, it's safe and it's effective. It's about somebody who sitting in a chair saying, well, here's what the data shows, or here's why I got the vaccine. And also saying, look, I'm not trying to sell you anything. I'm not trying to force you to make a decision. I just want you to have good information. I want to tell you what's true. And I want to tell you what's made up, what's manufactured, what's just straight up disinformation, because I want you to know what's real and what's not, so you can make the best decision for you and for your family. And I think that those are the kind of authentic conversations from trusted messengers with trusted messages that are going to actually move the needle with regard to vaccine confidence. And so I think, for everybody, no matter who you are, you don't have to be, a practicing physician or somebody who does policy work on COVID. Literally just be anyone speaking from your own experience, sharing why you feel the way that you do, because there are a lot of dark corners of the internet that'll give you bad information. And so getting good information from your colleagues, your friends, your neighbors, your loved ones, that's really valuable.
I'm really happy that you mentioned that. Again, that just goes back to my point, y'all. Sharing is caring. Make sure you get this information out there. And I think that's a really good point, and hopefully we can touch more on it. Guys, Dr. Webb will also be on our show on Thursday, Chicken Box, which I wanted to save to tease until the end. But I hope we can touch more on that, because I think a lot of the difficulty and misinformation that started with COVID-19, particularly in the Black community, is that these places, these gathering and watering holes that we had, like the barbershop, like the nail salon, like the beauty salon, all these places were closed, right? And so you're just getting all of this misinformation from these dark places on the internet. And that TikTok that just was completely wrong. I mean, for weeks, we spent a lot of the time at when the pandemic started at the Afro, just saying, yes, Black people, you can get COVID-19. And so again, we just really appreciate you working on the front lines of this and making sure that you're dispelling these myths and getting the right information to the people. All right, two quick yes or no questions before this Thursday. If you have a pre-existing issue, or you've had a challenge like myself with vaccines in the past, should you still go get the COVID-19 vaccine?
The short answer is always talk to your doctor or some trusted health professional to help guide you based on your own unique circumstance. But I'll just say there are very few instances where people shouldn't get vaccinated. If you've had a history of a severe allergic reaction to vaccines, that's worth a conversation with your doctor. If you have a chronic medical condition like high blood pressure or diabetes, you're one of the people we want to protect with vaccines. And so the conversation is best held with your provider. Hopefully you have one, if not a trusted health professional who you can get in touch with. But for the great majority of people, with very few exceptions, this vaccine is safe and effective.
Okay, and then this is not yes or no, which I told you it would be, but I have to ask it. And I should start by saying I got the vaccine on Thursday. I went live for our Afro viewers. I normally feel leery about vaccines. I had a really bad reaction to the flu shot a few years ago, and so but I'm fine, guys. I'm fine. But I in my own research, found a lot of different information and what I'm calling misinformation about treating any small symptoms that you get post-shot. I had severe arm pain, not just in the injection site. And I teach Zumba on Fridays. And so I taught Zumba early Friday morning after Thursday getting the shot, which probably didn't help. I could not find a solid answer on what to do with the the pain. Do I take a Tylenol after? What should one do post?
Yeah, it's fine to take a Tylenol. I think what most folks are hearing on the internet is like, don't take an ibuprofen or Motrin or something like that because it can dampen your immune system, because the category of medication it is an anti-inflammatory, right? The thing is, by and large, it's not going to have a huge effect on you if you need to take one of those medicines. But if you're going to take one, I think Tylenol is a pretty good choice because it doesn't have as much as the same kind of anti-inflammatory response that the other ones do. But I think, yes, you can treat some of those symptoms. Just keep in mind that with these vaccines, the symptoms tend to go away within 24 to 36 hours. So what I tell people is kind of plan around that shot. That next day, I had pretty minimal symptoms. I had, some soreness in my arm and a little bit of a headache with the first shot. With the second shot, almost no symptoms at all. For my wife, she spiked a fever with the first one and was, kind of out for the count for about 3 or 4 hours. Second shot, she was out for the count for about 12 hours. She wouldn't have been able to work that day, And so we always tell people, plan around that second shot in particular may cause some challenges. You may feel unwell. It's not because you got COVID, right? The shot is not capable of giving you COVID. What it means is that your immune system is ready to go, ready for action should you ever encounter the virus in real life. And so I think the key is we know that these side effects of the vaccine happen. They're expected side effects, and there's nothing bad about them, and they go away within 24 to 36 hours. But if you need something, I think Tylenol is perfectly safe and appropriate.
Thank you so much, Dr. Webb. I must admit those last two questions were a little bit on the selfish side, but I had to get them out. And I know people are out there wondering as well. We get these questions in our comments and our DMs all the time. Guys, I know that you want more of Dr. Webb. I so do too. I have 40,000 more questions, but guess what? He will be on Chicken Box on Thursday at noon. And that's the time. You guys know Chicken Box is our time to dispel all the myths, all the stereotypes, talk about them, get on the box, as we say, and speak our truth. And so this is the time. You guys see, Dr. Webb is already so incredibly transparent, so I can't wait until he gets on the box.
Let's do it. Looking forward to it.
We are looking forward to it as well. Thank you so much for your time today, and we'll see you on Thursday.
Sounds good. All right. Y'all take care.
Take care, everyone. And guys, remember, mask up, wash those hands, and Black Lives Matter.
Indeed.